Dr. Singh, dental implants can have a direct impact on jawbone health. Can you explain that, please?
Certainly. When a tooth is extracted, there's a normal tendency of the bone surrounding it, the alveolar bone as we call it, to resorb away. And we believe that that's the body's natural response to no longer having something to support in that area. And we find that a lot of the bone resorbs away over time. Resorption is a biological process, which basically means dissolving away. So you actually see the bone level drop away, which means there's less bone available afterwards to place an implant in. One of the things we like to do is place an implant wherever possible, and by that I mean there has to be no infection, etc. Wherever possible, we'd like to place an implant immediately upon extraction of that bone. And we find in those situations that we're able to largely maintain the majority of the bone. The body actually never resorbs it away because there's something there now. There's still a force and there's still the need to support something, and therefore that bone remains instead of losing it. And at that point, we end up with a much more stable implant and more bone, hence a longer and sometimes even wider implant is possible, and therefore something that much more approximates the original length of the root of the tooth. And overall, with the combination of the architecture, the gum tissue, and the bone structure being maintained, we get the most natural result possible. So not only does the tooth look nice coming out of the gum tissue, but the gum tissue and the bone around that tooth look completely natural. If it's left after the fact, if we leave it to heal and come back 6 months later, for example, to place the implant in, that bone has shrunk. It's shrunk in height, vertical height, and it's shrunk in thickness also. And sometimes, even though it's possible to place an implant, when we place the implant at that stage, what we find is that if you look at it carefully, it doesn't look quite natural. And there's not necessarily anything wrong with the shape of the tooth, but the gum above it looks a little concave or a little bit flatter because of some bone loss. And so it doesn't look as good as it could, certainly to a trained eye. And that's why we like to maintain the bone structure, architecture, and keep the most natural look possible.